Good morning everybody. So today I will discuss about the nerve of superior extremity. So we know the brachial plexus. The brachial plexus, I have given you the tricks to know the brachial plexus. Three things you have to remember. Is it from C5 C6 root value? Is it from C5 C7 root value, or is it from C8 T1? Only C5, and adding C7 to C8 T1 and C5 to C8 T1, adding C5, adding C7, only C5. So this is the mnemonic. So C5 C6, two things, it can be from the trunk or it can be from the posterior cord. If it is from the trunk, then two things, that is the subclavius nerve, subclavian nerve, or it can be the suprascapular nerve. If it is from the posterior cord, three things you have to remember. Is it the axillary artery, axillary nerve, axillary nerve? Is it the upper subscapular nerve, or is it the lower subscapular nerve? So upper all have C5 C6 root value of the posterior cord. Now I will talk about the C5 C7. C5 C7, two things. Is it from the root? If it is from the root, then it is the nerve to long thoracic nerve or nerve to serratus anterior. If it is from the lateral cord, so it will be lateral pectoral nerve, lateral root of median nerve, or it can be musculocutaneous nerve. So these three. If it is from C8 T1, only one, medial cord, three nerve, medial pectoral nerve, medial root of median nerve, or is it the medial cutaneous nerve of arm and forearm. So this is all about the brachial plexus. If we add C7 with it, then it will be the ulnar nerve, and if we add C5 to it, then it will be the radial nerve. If only C5, dorsal scapular nerve, or it is known as nerve to rhomboideus. Okay, so now I will come to the median nerve. So median nerve, there is a ventral rami. Okay, all the nerves are ventral rami. So there is a lateral cord, there is a medial cord. Let us assume this is the lateral cord. So this is the lateral cord, this is the medial cord. Okay, this is the medial cord coming from the medial root coming from the medial cord, that is C8 T1 of the ventral rami, and the lateral cord, which is the lateral root of the median nerve, is coming from the ventral rami of C5 C7 from the lateral cord. Okay, so it is lateral root and medial root. Okay, so it is the origin. Now there is a axillary artery. Okay, so it will cross the axillary artery, the upper part of the axillary artery. So this is the axillary artery. In the upper part of the axillary artery, it will cross and join with the lateral root of the median nerve. Then it will be lateral to the axillary artery, and axillary artery will change its name to brachial artery in the arm. Then at the mid of the arm, this nerve is parallel to the crosses the brachial artery. It is parallel to the brachial artery up to the mid of the arm. Up to the mid of the arm, it will parallel to the lateral and parallel to the, so this is the lateral side, this is the medial side. So it is lateral and to the brachial artery and parallel. In the axilla it is parallel to the axillary artery, but the medial root crosses the axillary artery in the axilla, and now in the mid of the arm it crosses the brachial artery and comes to the cubital fossa. In the cubital fossa it is anterior to the cubital fossa, so it is anterior to cubital fossa, but it is slightly medial, but anterior to the cubital fossa. Okay, now the in the cubital fossa between the two head of the pronator teres, so this is the pronator teres. So between the two head of the pronator teres this nerve enters, and it lies in the forearm. So it lies in the median plane of the forearm, giving one branch to the interosseous nerve, which may be anterior and the posterior interosseous nerve. So this nerve will supply the muscular branch, which is the flexor compartment. All the superficial flexor muscles except flexor carpi ulnaris, all the muscles, pronator teres, flexor digitorum superficialis, all the muscle, palmaris longus, all the muscles are supplied by the median nerve except this flexor carpi ulnaris. The anterior interosseous nerve will supply only the anterior interosseous nerve will supply the deep muscles. So what are the deep muscles? Now coming to the deep muscles. So what are the deep muscles? Deep muscles is pronator quadratus, the flexor pollicis longus, and the lateral half of flexor digitorum profundus. So pronator quadratus, flexor pollicis longus, and the lateral half of the flexor digitorum profundus will all supply by the interosseous nerve. Deep muscles are supplied by the interosseous nerve. Now in the forearm, the median nerve lies between flexor digitorum profundus and flexor digitorum superficialis, but it is adherent to the flexor digitorum superficialis only. Okay, now in the it lies in the flexor retinaculum. So it is beneath the flexor retinaculum, and it lies medial to the thinner muscles. So medial to the thinner muscles, and it will supply all the thinner muscles, that is the flexor pollicis brevis, abductor pollicis brevis, and opponens pollicis. All the flexor muscles of the forearms are supplied by this median nerve. Okay, and median nerve also supplies the 3.5 cutaneous supply to the lateral. 3.5 cutaneous supply in the dorsal side is given by the median nerve. Okay, so this is all about the median nerve, and the median nerve also supplies the lumbricals, the first and second lumbricals. Okay, so median nerve also supplies the first and second lumbricals. First and second lumbricals are also supplied by the median nerve. So median nerve, why it is median? Because it is in the median plane of the forearm, so it is median. So this is the course of the median nerve in the forearm, in the arm, in the forearm, and in the cubital fossa, in the hand. Okay, in the wrist it is medial to the, it is just beneath the flexor retinaculum. So if there is a carpal tunnel syndrome, so there is a compression of the median nerve. So median nerve will be compressed and causing the compression to these muscles also. So these muscles will not be supplied by this nerve. So there will be a claw hand deformity or a F thumb deformity. Sorry, there will be F thumb deformity, not the claw hand deformity. There will be a F thumb deformity. Okay, so this is all about the median nerve and its course. Thank you.